Hi guys, I'm Dr. Iraniha, and today I'd like to discuss with you about the mini tuck surgery. The mini tuck, also known as dry tuck procedure, represents a groundbreaking advancement in minimally invasive surgical techniques designed to address diastasis recti, tighten the abdominal wall, and remove excess skin. This innovative procedure is particularly effective when combined with laparoscopic repair of diastasis recti. Well, diastasis recti refers to the separation of the anterior abdominal muscles, commonly known as the six-pack muscles. This condition frequently affects women post-pregnancy, but can also manifest in men, particularly those with a genetic predisposition or significant obesity. Individuals with diastasis recti often experience a noticeable bulge in the abdominal wall, accompanied by symptoms such as lower back pain, diminished core muscles strength, and poor posture. While conservative interventions such as physical therapy may enhance core strength, they do not rectify anatomical separation of the abdominal wall muscles, and surgical intervention is essential for effective repair. Traditionally, tummy tuck surgery has been the sole procedure available for addressing diastasis recti. However, this method typically involves extensive skin dissection and separation from the muscle, which can lead to various risks and complications. The mini tuck addresses these concerns by implementing a minimally invasive surgical approach. By significantly reducing the extent of dissection required, this procedure aims to decrease the risks associated with surgery, including wound infection, seroma formation, and skin necrosis. Additionally, patients often experience a shorter recovery period compared to traditional tummy tuck procedures. When performed in conjunction with laparoscopic repair of diastasis recti, the mini tuck offers a dual repair strategy that targets both the front and back of the abdominal wall muscle defect. This synergistic approach not only enhances surgical outcome, but also promotes a safe and more efficient recovery process for patients. It is important to note that not everyone is a suitable candidate for this minimally invasive surgery. At Surgical Oasis Institute, we conduct thorough evaluation to determine the appropriateness of the mini tuck for each patient. Our comprehensive assessment ensures that individuals receive personalized care tailored to their specific needs and conditions. In summary, the mini tuck is a promising option for those seeking effective treatments for diastasis recti, combining safety, efficiency, and a reduced recovery time in a minimally invasive format. For more information or setting up a personal or virtual consultation, please call 949-646-8444. Thank you.